Hello and welcome. Today we'll be presenting the new Asa Dental 50/50 articulators. These average value non-Archon articulators are lightweight, precise and versatile, suitable for everyday work and complex cases alike. The ability to be used for different purposes and disciplines makes these articulators unique. The benefit of being multifunctional is that a single articulator can be used to create models with different techniques and methods, including case-specific ones, where a special kind of articulator is required. One such application would be making prosthesis according to neuromuscular theory. To work with this technique, dental technicians must buy a special articulator that, being monodisciplinary, cannot be used for techniques other than the one it was designed for. It goes without saying that a dental laboratory that works with multiple dental studios will often be forced to purchase use-specific articulators. This is true for our neuromuscular example, but also for other theories such as those of Slavicek, Pound, Gerber, and the countless others that, due to their specificity, force dental technicians to buy an inventory of costly articulators. Now let's take a look at how one single articulator can be used for all types of procedures, from the simplest to the most complex. These new articulators come in two versions, the 50/50 and the 50/50 Plus. Both are the latest evolution of the 5000 model. The 50/50 has been designed for dental technicians who are used to the 5000. It is essentially used in the same manner, but we've also added some structural innovations and a new template. The 50/50 Plus features more parts, making it a complete articulator, suitable for even the most demanding professionals. These new articulators are the result of years spent studying the 5000. Maintaining its strengths and improving upon its weaknesses until we perfected these new one-of-a-kind versions. Let's take a more detailed look at the characteristics of the two articulators. Structurally speaking, the 50/50 and the 50/50 Plus are identical. We've maintained one of the key strengths of the 5000, the ability to work with the articulator upside down. The stability of the articulator while upside down isn't only important when casting the lower model, but rather indispensable when having to deal with Class 3 malocclusion, in which to cast or shape the teeth in an overlapping manner. Unlike the 5000 series, the 50/50 model is also stable at 60 degrees with the ability to be tilted. Dental technicians tend to be seated while working. In order to get a better view of the product they are creating, they often hold the articulator at an angle. Our studies have shown that the ideal inclination is 60 degrees. Another improvement featured on the 50/50 model is the anti-rotation incisal rod. One of the main issues with the 5000 and other articulators also is the involuntary rotation of the incisal rod. Involuntary rotation of the incisal rod can cause the dental technician to lose the center indicated by the dentist on the occlusal plane, affixed by the dental technician via the incisal pin. The 50/50, like its predecessor, makes it possible to carry out mandibular excursions, both lateral and protrusion, effectively replicating Posselt's diagram of motion based on mean values. The 50/50 Plus also features a rear stop with a guide, so as to maintain vertical alignment when the rod is removed, but also so that mandibular excursions based on preset mean values can be carried out. Now let's take a look at the additional components included with the articulator, starting with the occlusal table, which is much more sophisticated compared to that of the 5000. There are quite a number of differences, starting with the stability provided by the tripod on the base, ensuring a single consistent position. While maintaining the incisal notch, the new table also features a midline, 2 key lines and 4 guidelines for mounting or casting teeth. The addition of a fourth line is quite important, increasing the likelihood that the teeth in the case being worked on fall exactly on one of them. In fact, when there are only 3 lines spaced widely apart, the assembly of the model often ends up between 2 of them, drastically reducing the usefulness of this reference point. The table and the template are in a special glass bead material that is resistant to heat, pressure, and all materials used in dental technology. Because they are not made of metal, the plate and template do not release metal ions. The template has the same characteristics as the table, the only difference being the convex shape, and is used for products starting from the lower arch. The assembly support for the table and the template is the same, interchangeable, and made of the same glass-based material. The screw head has retention elements that affix the model to the table or the template via the modeling material to stop it from shifting while making the cast. For more stable casting, the 50/50 Plus model features a magnetic incisal rod, which keeps the articulator closed perfectly and blocks vertical movement as the cast hardens. Thanks to the powerful magnet in the rod, the articulator can be used as a grip. It is thus possible to polymerize prostheses and temporaries and realign and create any other sort of model, as the articulator fits perfectly within all pressure polymerizers. 50/50 articulators from Asa Dental thus make it possible to complete any type of task, from the simplest to the most complex, using the component that best suits the job at hand. Summarizing, there are now 2 new articulator versions. The 50/50, which features an occlusal table, template, and the ability to work with the articulator upside down and at a 60-degree angle. And the 50/50 Plus, which features an occlusal table, template, and even a magnetic incisal rod and a back rod system, plus the ability to work with the articulator upside down or at a 60-degree angle. Please visit www.asadental.com for complete information and to download the brochure.